Okay then. So I can open the meeting and welcome everyone. I think traditionally we do a quick round of introductions here. So if I just read out the names as they appear on my list, and if you could say just who you are, where you're from, please. I'll start with me. I'm Councillor Rob Chapman. I'm the Cabinet Member for Finance, while Rebecca Renison is away on maternity leave, so best wishes to her. And then the next person on my list is Anisha Hilal, I think it says. Hilali. Sorry, the text is about 6 points, so if I do get your name wrong, I do apologise.
Afternoon, Chair. I'm one of the legal officers in the procurement team. My colleagues Patrick and Clive are also here in attendance. Okay, Councillor Bramble. Yeah, just a smile would do, I think.
Thank you, Chair. Councillor Antoinette Bramble, Statutory Deputy Mayor, Cabinet Member for Education, Children's Social Care and Young People, and welcome Councillor Chapman as Chair of the meeting.
Thank you very much. Candice Bloomfield.
Hi, Candice from the procurement team looking after construction and environment.
Councillor Woodley.
Hi, yes, welcome, Chair. I'm Caroline Woodley and I'm the Cabinet Member for Families, Early Years, Parks and Play.
Councillor Kennedy.
Councillor Chris Kennedy, I'm the Cabinet Member for Health, Adult Social Care and Leisure.
Clifford Hart.
Good evening, Chair. I'm Senior Governance Officer and responsible for the clerking and overseeing of this meeting this evening.
Clive Sheldon.
Good evening, Clive Sheldon, Legal Services, Procurement and Contracts team.
Dawn Cafferty.
Good evening, Chair. Dawn Cafferty, Procurement Category Lead for Social Care and Public Health.
Thank you. Denise D'Souza.
Denise D'Souza, Interim Director for Adults, Public Health and Integration.
Jade, so let's see, get this one. Sorry, I don't know how to pronounce it. Masika?
No problem. It's Jade Machita. I'm the
Machita. My apologies.
No problem. I'm the Interim Strategic Procurement Manager in the Central Procurement Team.
Welcome. Judith Hughes.
Good evening, Chair. I'm Judith Hughes. I'm the Category Lead for Corporate Services within the Procurement Team.
Karishma Mahmood. Sorry.
Good evening, Chair. I'm Karishma Mohammed, Trainee Solicitor of the Legal Team, observing today's meeting.
Mario Karaman.
Good evening, Chair. Mario here from ICT Service Support, here to provide technical support with the meeting live stream.
Yeah, the man without none of this would be possible. Matthew Kane.
Thank you, Councillor. Matthew Kane, Head of Customer Services, Digital and Data.
And Merle Ferguson.
Good evening, Chair. I'm the Procurement Strategy and Systems Lead. I look after the Corporate Procurement Team.
Patrick Roger.
Thank you, Chair. I'm Patrick Roger, Senior Lawyer in Legal Services.
Yeah. Rob Miller.
Apologies, fumbling to mute. Hello, Rob Miller, Strategic Director for Customer and Workplace, and just here joining Matthew for the item on telephony.
Rotimi Ajilore.
Thank you, Chair. Rotimi Ajilore, Head of Procurement for the Council. Welcome yourself and Councillor Kennedy to Cabinet Procurement Committee.
Thank you. And Sharon Ellis.
Hello, I'm Sharon Ellis. I'm Strategic Commissioner for Older People and Long-Term Conditions, and I'm presenting the paper on home care extension. Thank you.
Okay, thank you all very much, and welcome to everybody. So, yeah, I've just got a few formalities here. In terms of the meeting being held in public under the current emergency procedures, any member of the council can ask a question. Any member can attend under normal rules and ask to speak, and this can be agreed by myself, the Chair. Chair to advise that the meeting will be live streamed for public viewing and will be uploaded after the meeting together with a decision sheet showing the decisions taken at the meeting. The press and public will be asked to leave the proceedings after the public business has been completed. So I think that's all. So Clifford, I think you've got a few more.
Yes, thank you, Chair. Just to run through the protocol for the meeting, I know everyone probably has attended before, but it's always useful to run through and remind members, officers, and any public attendees in the public this evening. So if I could ask that all attendees only speak when invited to by the Chair. All participating members to keep their cameras on during the proceedings. However, if you have a bandwidth issue, then it's quite understandable that you might need to have your camera off and only have it on when you're actually speaking. If you are speaking, again, ensure that your mic is on, but otherwise, please ensure that your mics are turned off. If you are referring to a specific page number or picture in a report or diagram, please can you clearly say that the page number or diagram. And we appreciate that as this is a live meeting, we like to ensure that there is inclusivity and ensuring that everyone takes part. Therefore, we would ask people to speak slowly and clearly and allow for that in these proceedings. If you're having any technical difficulties, please use the chat function, the little box in the right-hand corner. But Mario will assist as best as he can. And just to say, please do not use the chat box for any other reason, as it is visible to the live stream. And if there is any persistent or disruptive behaviour by anyone, they will be removed from the meeting. Thank you, Chair. Chair, you're on mute.
That won't be the first or last time that happens. The next thing will happen is I'll turn myself off mute and cancel myself out of the meeting instead. And I think on the errors on sort of virtual meetings, we'll discover new ones as we go along, no doubt. But anyway, yeah, thank you. Right, so apologies for absence.
There are no apologies for absence, Chair.
Okay, can we just note the appointments as set out on the face of the agenda, which is namely me as chair and Councillor Kennedy as a new member. So I think note me and welcome Councillor Kennedy.
Noted and welcome.
Thank you. Thank you very much.
Thank you.
There are no items of urgent business I'm aware of. For declarations of interest, are there any declarations of interest to declare? I see that as none. No, everyone's shaking their head. We have no notice of intention to conduct any business in private, that's my understanding. And no questions, deputations or petitions to consider tonight. Okay, so we can then move to item 8, the Home Care Framework Extension Report. And if I can sorry?
We just missed minutes, Chair.
Oh, sorry, I do apologise. Unrestricted minutes of the Cabinet Procurement Committee held on the 15th of February. Do we agree they were a true record for those?
Agreed.
Agreed. I won't go through them in detail unless someone wants to raise something. That's all right. Okay, agreed. Okay then, so Home Care Framework Extension to support the retender process, item 8. I'm to invite Sharon Ellis, and I understand Denise D'Souza is also in attendance, so one or the other to introduce the report, please.
Do you want me to introduce it? Oh, sorry. Okay. Hello. The report requests that CPC agrees to extend the current framework agreement for the delivery of home care services with the 8 existing home care providers, as listed in Appendix A. As stated, the estimated total spend for this is for £14.2 million. With regards to the reason for the request is as you can, as it states within the actual report, it talks about we are committed as a council to ensure that residents that require home care gets high quality care that is consistent and meets their needs. The delivery of home care helps residents remain as independent as possible and delays the long need for any form of residential care. It's recognised and acknowledged during the current COVID-19 pandemic that home care services were very integral to the health and social care system to allow us to continue. The current framework providers were able to provide additional capacity during the first wave of COVID-19 as well as during the second wave, and the third wave was also supported the wider care system during the winter pressures. The framework is due to end on the 31st of March 2020, this month, as well as to support the current challenge being faced by the health and social care system following the effects of the pandemic and the recent cyber attack on the council's IT system. It is prudent that the existing home care providers on the framework are given a suitable extension to help them to support our residents, stabilise their organisation, ensure they are sustainable in the long term. This helps the council meet its duty under the Care Act Section 5, which requires local authority to ensure there is sufficient quality provision in the area. Are there any questions? I think that's a summary of it, if there's any questions at the moment. Sorry, it's gone a bit...
Okay.
Councillor Chapman, I think your sound is coming in and out.
I can't hear.
Can you hear?
I can't hear. Sorry.
No, you're cutting in and out. I don't know. Would it be helpful for you possibly to leave the meeting and rejoin? And in your absence, could I ask members if they have any contributions? Is that all right?
Yes, Vice Chair, I think that's fine, Councillor Blackwell. Thank you.
Okay.
Thank you.
Oh, you're back. Colleagues, do you have any questions?
Councillor Woodley is still in her hands.
Councillor Woodley.
I was just very interested in the breakdown of the framework across the three lots and sort of noting, I guess, the culturally specific care for Turkish Kurdish communities and also the Orthodox Jewish community. I wondered if there was a sort of a need to expand that framework, if you felt that was comprehensive. It feels comprehensive to have the number of providers that we do, but I wonder if there are any gaps that we should be alerted to.
There isn't the current framework with the existing providers. There hasn't been any noticed gaps within those two culturally specific lots. So I think what we'll need to do going forward when we recommission the service again, hence this extension will help us, will identify. But there hasn't been any. There hasn't been identified gaps with those two specific culturally specific lots that have been as part of this framework, to be fair. I mean, with regards to that, we'll need to take on board when we do the redesign of home care about, because we're engaged in consulting at the moment with the redesign for the new home care service. And we've actually asked our Health Watch colleagues to help us with the consultation, and that hasn't sort of been. So what I'm sensing from your question is there's sufficient providers out there to capture the Orthodox those two culturally specific providers, but there hasn't been an issue as such with regards to that of this life of this framework. But we obviously will take on board all of, when we go out to recommission, we do engage with those two culturally specific and wider around what is needed in the future, because demand is increasing too. That's something that we would look at. So it was okay at this time when we recommissioned, when we awarded the contracts in 2016, but when we go to do the next one, we'll need to take on board that there's going to be an increase of demand. So we will take that on board. I hope that answers your question.
Yes, thank you. Very helpful. Thank you.
Thank you. Councillor Kennedy, did you have any contributions?
I would just like to draw members' attention to, I can't remember where it was in the report. It's somewhere in 6.2, drawing our attention to the fact that extending this allows us to better consider, as we re-provision this contract, the possibility of insourcing some or all of it,
Yes.
alongside the council's stated intention, for which indeed we had a paper at our last meeting about insourcing. Thank you.
Okay, now shall I? Do you want to continue this? Just to finish this item, Councillor Bramble, because I missed the first half of the discussion. Yeah. Yeah. Do you think that makes sense? I can't hear you.
I'm happy to do that, Chair.
Yeah. Okay.
Sharon, would you like to respond to Councillor Kennedy's comment?
Yes, it's true. That will be considered, absolutely, as any part of any redesign or recommission of service, whether it be home care. We will obviously do an options around insourcing, and we need to demonstrate that. And well, that's through the process that I'm currently gathering the data, asking for costing models, because we currently deliver over 22,000 care hours. So we'll need to, over with those providers, we'll have to take that into consideration. And most definitely, that's always something as a standard that we will look at doing the options appraisal, and they will look at we'll look at the option of insourcing as well as external. So those information will provided as part of the options appraisal. That will be fed into obviously the business case that will come to CPC. So you will see it when I do the business case, which will be. I need to look at the timeline, but my colleagues from Procurement, Dawn Cafferty, has helped me with that timeline. But most definitely, insourcing is always considered. Does that respond to your question, Councillor Kennedy?
Thank you. Yes, I just, to be absolutely specific, Vice Chair, it was paragraph 6.2 on page 11. Thank you.
Thank you so much, and we welcome that coming back at some point, looking at insourcing, and even when it's not financially viable, sometimes straight away looking at the long term, what that looks like going back. So thank you. There are no further comments. Councillor Kennedy, can I make the assumption that's a legacy hand in the new virtual world of language? Okay. So on that note, I want to advise there is an exempt Appendix A at item 14, and members will need to wait until then, until we end the public meeting, to be able to discuss that as part of the proceedings, to seek any points of clarification from the exempt appendices. Is that all right? And then following that, we will move to recommendations that are set out in the report, to note and agree that the exempt appendices A and 14, and in item 14 as agreed and set out.
Agreed.
Agreed. So on that note, I'm happy to welcome back the chair and hand back over to the chair to introduce item 9. Thank you.
Thank you, Councillor Bramble. Sorry about that. I don't a connection problem, obviously. Hello, can you hear me now? Because everyone's disappeared again.
We can hear you.
Okay, I'll just plough on. Okay, the next item is item 9, telephony and contact centre cloud solution, and I think it's been introduced by Matthew Kane and Rob Miller, so I don't know which one's going to start.
Thank you, Councillor. Rob, are you okay if I make a start?
Absolutely.
Yeah.
Super. So this ought to be really simple. We're buying a phone system because our current phone system shortly will be out of contract. As ever with technology, it's not quite as simple as one might hope. So I thought it might be useful by beginning to explain what we're not purchasing. So we aren't purchasing the physical devices that might sit on people's desks where you lift their handset to talk to a resident. And we're not purchasing the mobile phone, either devices or the SIM cards that go in the mobile phones. On the first, that's because we have enough desk phones and we need fewer of them. And on the second, it's because we know that we would be better off now purchasing those directly from a mobile provider. So in terms of what we are asking permission to purchase, I think that's probably best explained in table 9.2, but just to talk you through what we mean by that. So the first thing, which we describe as a cloud-based voice over internet protocol communication system, that's the way in which if you call 020-8356 and then a direct phone number, the phone then rings at that person's desk. Now, practically speaking, because it is cloud-based and it works over Internet Protocol, that means the person can be sat anywhere in the world on any device in order to answer that phone call. So that's the first element. The second element is then the technology we use to take calls in the customer services center to handle web chats and to manage our other contact points with residents. By being able to do that, we have identified with the preferred supplier that we will also be able to bring into scope other parts of the contract which weren't expected at the point of seeking permission for this procurement at business case. So firstly, we have a technology in the council at the moment that enables you to phone the switchboard and ask to speak to someone and get put through. We'll be able to replace that as part of this proposal. We also have a set of phone lines that run through older technology, so ISDN lines, which you might have used previously for a radio interview, for example, as a counsellor, which we believe where we'll be able to switch those communications lines onto this new provision. And then significantly, the phone system operated previously by Hackney Learning Trust, where there's also scope for bringing that within the remit of this contract. So this proposal doesn't have any effect on staffing. It's replacing one phone system with another. In terms of the cost of the phone system, so the strength of the proposal is that it enables us essentially to buy per use. So in a way that you might be familiar with in purchasing a mobile phone contract, we can buy bands of both levels of service and the number of minutes that you get within that band. And there's a significant proportion of council officers who need to have a phone line, but don't actually use that phone line for outgoing calls. There are, of course, a proportion of officers who need a phone line and make a substantial number of phone calls. So what we've tried to do in the costings table in 9.1 is set out the set of scenarios that we've used to come to the cost assumptions for both of the things we're purchasing. There's a scenario in which we aren't able to reduce the number of connections, because we need a connection for every member of staff, and that's set out in the first column. There's a more likely scenario where, using the data we have available today, we can see that there are a significant number of staff who actually don't appear to need a phone at all. And then there's a third column which is slightly more complicated. So there's a possibility in the future that we may wish to provide services to residents over the phone which don't actually involve speaking to someone. So, for example, during the first phase of lockdown last year, we experimented with a service where tenants could phone up, they could ask for their rent balance, and they could go on to make a payment, and they could do that at any time of the night or day, any day of the week, without speaking to someone. That pilot was popular and it was well used. It's an example of where we would actually spend more on the cost of the phone line, but we'd expect to make savings elsewhere in the organisation. So that there is a scenario which would lead to the cost of the phone line being higher, but the overall cost of providing the service being lower. So I hope I've rambled on enough by way of an introduction for what it is we're purchasing, what that means practically, what that means financially, and what that means in terms of staff, and obviously delighted to take questions on the detail.
Thank you very much. I should add that there's been a short addendum report been circulated to members, which I think it just explains some of the issues that are raised in the original report, but it makes clearer, the nature of the changes in the service and the savings that we can expect from it. Okay, can I ask if Rob Miller wants to add anything before we open for questions?
Thank you, Chair. No, hopefully it's all set out as Matthew described in the paperwork.
Excellent, thank you. So can I ask if there are any questions or comments on the report, please? Councillor Woodley.
Sorry, not a very intelligent question, but I'm just trying to unpack the legacy telecommunications, ISDN, etc. And I guess a little bit of reassurance about the necessity of these. It's not a small sum of money to bring them over. We've obviously had a bit of an odd year. I imagine you have done an audit and you're reviewing this to be as cost effective as possible. I'd just be grateful for a little bit more information so that it's clear in my head.
Yeah, that's right. So these are lines that we had to install in previous years for a whole bunch of very specialist purposes. So perhaps another example, in addition to the ISDN, might be an alarm that we've installed in a lift in the event that someone gets trapped in a lift. So there are a bunch of these connections all around the borough, meeting some very different use cases. So the aim of the programme is to decommission as many as we can, to shift them over to this pay-per-use model, because it will be substantially cheaper. We are applying some caution to that because we know how critical some of them will be, and we will need to ensure that we've got a very clear audit log, just as you said, Councillor, of exactly what each line is doing. And we know that there are some which might be as simple as simply deactivating them, and others where we need to proceed with more caution.
Thank you.
Okay, are there any other questions or comments? Okay, so if we can, can I just bring to members' attention that there is an exempt item, Appendix 2 at item 15, and members, obviously, if you want to ask a question, we'll need to exclude the members of the public for that. We're happy to move on without asking questions on Appendix 2, or does anyone got anything on Appendix 2? No, okay then. So can we move to the recommendations in the report? And just to clarify, the first recommendation is to note. The second recommendation, where it says progress, is actually to agree the tender, and then the third recommendation is to note the appendix. So if members are happy to do that, Michaud?
Yes, Chair.
Yeah,
Noted
okay.
and agreed.
Thank you very much. If we move then to item 10, which is an information report on the, well, you can say what it is, on basically statutory repair and maintenance in the council buildings. The report was circulated after the agenda had been published, and it's an information item update, and there are no decisions to take other than to note the update. But can I then move to ask Nick Grimwide or Chris Pritchard to introduce the report and respond to any questions? Don't know which one are you again? Nick, is it?
Evening, Chair. Hi, Chair. I'll introduce the report as Chris Pritchard, Director of Strategic Property Services.
Thank you.
Didn't introduce myself at the beginning, apologies for that. Right, the report is being submitted following our previous report to CPC seeking authority to implement an interim maintenance contract while we established a longer-term strategy for the delivery of the council's corporate maintenance services. Part of that was a commitment to look at the potential for insourcing elements of the next maintenance service. And that's what we're reporting on now, progress on that journey. The report is fairly brief. We've completed an independent independently led exercise on what we should or should not insource, and that has come up with a number of recommendations that are set out in the report. We also have an advisory team more or less in place to help us with the next procurement. And essentially this report is an update on our progress towards that next phase of procurement and implementation. So, in essence, and sort of summarising as briefly as I can, it's my belief that in moving forward to the next phase of the council's corporate maintenance delivery function, there are certain things that we've got to do. There are elements which we can insource, and there are elements that we simply don't have the capacity to do at the moment and won't have the capacity to do come the expiry of the current interim contract, and probably not for a little while beyond that. So in short, we will need another private sector provider, albeit we will be able to do certain elements in-house. Now, those elements I would suggest should be limited to the management of the computer-aided facilities management system, which is essentially the database that holds all our maintenance data across our corporate assets. And we can also take on the role of organising small capital works that arise from our maintenance work ongoing. Now, I should clarify that's not big capital projects like building leisure centres or schools or anything like that, but they're often projects which arise out of condition issues with buildings where you might decide to replace a roof or replace a modest extension or something of that nature. But it's not anticipated to be a large capital project. It's simply works that are sort of beyond the normal definition of regular maintenance. Now, it was also recommended we might safely consider insourcing the help desk function, and that's something that the council has done in the past. I'm not convinced it's right for us to do that at this stage, and I don't want to take that on right now. There are reasons for that, and a lot of that's to do with our capacity at present. So what I am suggesting we do is build upon our current internal team, which is quite heavily biased towards contractor staff. By that I mean agency staff, and stabilise that. Invest further in our computer-aided FM system so we get a good grip corporately of our own data, which is so critical to decision making and the efficiency of future spend on our buildings. And using those key staff, progress the most efficient and effective procurement of a new contract that we possibly can. That's probably where I'll leave it at the moment, except to say that in doing that, we are utterly committed to upholding the principles of the Council's excellent sustainable procurement strategy. We alluded to some of that in the report seeking authority to implement the current interim contract, and we think there's a good opportunity to build further on that going forward with the next contract. In fact, I would say probably more than a good opportunity. It will certainly be at the heart of our tender documentation, and we would hope that it would make the Hackney opportunity attractive to the sort of forward-thinking and sustainably minded contractors that we would prefer to work with. I should probably leave it there and leave it to members of the committee to ask questions at that point.
Okay, thank you very much. There's any questions or comments from members of the committee? Councillor Kennedy.
Thank you. I appreciate there are some services we might want to insource in the future, but it's not appropriate to do it now. I wondered, are there some expert services to do with this contract that it will never be appropriate to insource, or is the whole hard FM contract insourceable at some point in the future?
I think so. It's Nick Grimwade. I'm the interim maintenance contract manager, so co-presenting with Chris here. I mean, I think yes, the answer to that is there will always be some elements that we wouldn't be able to insource. I mean, there are some examples, but lifts, for example, is sort of one that you might kind of think of. But there's some specialist areas that it's unlikely the council would ever have the sort of the volume and capacity of work to justify self-delivery.
If I might add an element to that answer, thank you, Nick. I think the sensible place to look for capacity for insourcing is where we already have a DLO in place, and we do have an ongoing dialogue with housing services colleagues on the potential for that in the future. There are differences between, of course, the sort of properties that those guys and girls are used to maintaining. And I don't want to oversimplify it, but very typically they'll be used to dealing with bathrooms and kitchens and domestic premises, whereas a Hackney Service Centre, for example, has got air conditioning and all sorts of other complicated aspects to it, which require professional training and certificates to maintain. So there's quite a job there to build that capacity, and of course our colleagues in housing are also working to build their own capacity for the housing side of the organisation at the same time. I guess I'll leave it there.
Any other questions or comments? I've got a couple actually. Yeah, Councillor Woodley.
Only a sense of a timetable, if possible, Chris, in terms of bringing agency staff into permanent employment, or the kind of it sounded quite sort of tentative steps really that you were setting out, and I just wonder if we have a sense of a timetable for achieving those.
Yeah. Thank you. I was going to ask that question. I was also just to say, even if by December 21, I think is when you want to resolve this issue, we haven't been able to go as far with insourcing as we want. Have we got a timetable going beyond that where we can explore the issues that we aren't able to resolve this time going forward? So yeah, just if I just add that to your question, Councillor Woodley, that helps. I don't know it does, but
yes, I certainly can provide an answer to those two questions. In terms of increasing the balance between permanent staff and agency staff, there is work that we are doing at the moment with finance colleagues on our internal structure of strategic property, and as part of that we're looking at how we resource our maintenance client team at the same time. I don't have a specific program for that, but that is ongoing at the moment. So within the next month or two, I would hope that the budget will have been resolved, at least in practice and informally with finance colleagues, and we can crack on and complete our recruitment at that time. I don't envisage that this is going to be disruptive to our procurement, because there are certain, I would say, outstanding members of the existing team who are agency staff who have expressed a keen interest to join the council on a permanent basis. We just simply haven't had the posts available to do it. And so that's what we're working through with finance at the moment, and it's a situation that I and Nick as well have been very much looking forward to progressing. In relation, Councillor Chapman, to your question about arrangements beyond this coming December, and I presume what you're asking is, okay, so how long could we expect to be moving towards a more comprehensive in-source model?
Yeah.
I think to some extent that does depend on what our housing colleagues are able to develop and address their own capacity challenges at the moment, and I know they're working hard on that. We are, I mean, I have a regular dialogue with David Padfield, so I wouldn't want to misrepresent any ambitions that he has at this meeting. But certainly I would hope that over the course of the next maintenance contract, we would certainly be moving towards a sort of joint vision on and agreement on the sort of capacity we need and the skill sets we would need in the DLO to take on our corporate estate as well. It's quite, I mean, that is clearly a big job. The DLO is used to doing what it does. There would have to be extensive consultation and so forth. So I think the ambition is certainly there. It's an ambition shared by officers and members alike. And I think really it's something where we're having to be a little bit patient and take a bit of a lead from housing first. I really don't want to be doing something which is going to unbalance their own efforts at the moment as regards the capacity of their own DLO.
Thank you. Can I ask what hard FM is?
Yeah.
Because that's you mentioned in your report, and it's one of the...
Yeah, I'm sorry actually that snuck through without explanation. But really, we would regard hard FM as facilities, work on our facilities that is of a physical nature, where you're dealing with the equipment or in the building or the fabric of the building, and you're repairing it or upgrading it or maintaining it in some way. And in that sense, it differs from facilities management services that are more personal in nature, such as security or catering or cleaning, where you're not changing in any way the physical state of the buildings.
Sorry about that.
That's okay.
I can't access the control that operates the microphone and read the report at the same time. It's sorry about that. So it works. Okay, yeah. Has any other members got additional comments or questions on this? Any follow-up? Yeah. Okay. Just sort of comment. I think what I would quite like to know at some point is basically I can understand that some of these services are going to, when we're looking at our insourcing and sustainable agendas, some of them are going to be harder to fit within that than others. You know, as you say, the point about sort of lift maintenance and things like that are very specialist. I know that, but others you'd have thought could. So it would be helpful in the future maybe to have more of a sort of breakdown of the various elements of these services. And I personally would also like to see a longer term plan, you know, as I said earlier, in relation to things that can't be done by December 2021. Is that a reasonable request?
Oh, it's certainly. Well, we can certainly provide some commentary on that and some of the thinking behind the different elements of FM that you can sensibly insource and in what order you might do it.
Okay then. Okay, if there are no further questions or comments, can I ask that we note this report?
Noted.
Noted. Thank you very much.
Noted.
So just moving on rapidly. As far as I know, there are no items of urgent unrestricted business.
No, Chair.
I was supposed to ask the question, the dates of the Cabinet CPC for the remainder of the year, the next meetings will be the 12th of April at 5 p.m. and 10th of May at 5 p.m. Okay. I just think in relation to the exempt parts of the meeting, there's no questions been answered on the exempt parts, so I understand I can just move over that. Yeah. Okay, so I think that then brings us to the no urgent items, which I think brings us to the end of the meeting.
It does. Thank you.
I was just looking at Cliff to see if I've forgotten anything. No, okay. So yes, sorry about my exit. You know, stage left in the middle of the first item. Thank you very much for Councillor Bramble for managing that so expertly, with no notice. I was going to say short notice, but with no notice. So thank you all very much indeed, and we see you again. I've just read out the date on the 12th of April. Thank you all very much.
Thank you, Chair. Thank you, Chair.
Thanks, Chair.
Thank you, Chair.